Hello, everyone, and welcome to Pocket Size Bio of Dr. Casco. In this video, this is part 3 of chapter 14 on the spread and management of pathogens, right? Management strategies for pathogens, right? So this continues on from the previous video. And in this case, we're going to talk about monitoring disease activity, right? So this is essentially section 14.3, right? So let's get to it. A lot of things that I talk about, of course, are about Australia, but it's not limited to Australia, right? There's many countries that undergo these type of surveillance and certain management strategies and so forth, right? But, you know, um, just as other countries do in Australia also, right? When you have cases increasing in a particular location, right? Health authorities will start to monitor, right? If there's a trend ongoing, right? And this is happening at different regions within a particular country, right? At a state level, at a global level, right? And when you reach this level of spread, that is quite concerning, right? That is um, spreading out rapidly, you know, um, you start to get, the monitoring of diseases by the World Health Organization, right? Or the WHO, as we all saw from COVID, right? So this is an organization that, oversees, all the countries of the world and checks, on disease related, topics, right? And it basically would coordinate global responses, right? What should people do at a personal level, at a community level, states, different cities and so forth, um, what kind of responses should they implement, in a particular outbreak, right? That definitely uh, could be posing worldwide spread, right, and threats. So as we saw with COVID, right, that everyone was very attent to what the WHO was saying and practices, do's and don'ts and things like that. So, of course, it's um, in it's definitely, necessary. You must abide to certain things, right? Because you don't want the spread to of a certain pathogen to continue, right? So a little subtopic here, just getting into this idea of surveillance, right? Monitoring, right? National surveillance. And what this does is essentially a form of notification, right? You're basically diagnosing as a doctor, right? And then notifying. That idea of fast notification is very, very important, right? And then basically telling your health officials so they can report, they can tally, they create a statistic, right? Collect data. Data is so important when it comes to epidemiology and um, uh, checking, number of individuals that are infecting over a certain period of time in a particular area, right? It does happen frequently, and this is all the time occurring with different diseases, right? Influenza, chicken pox, syphilis, rabies, all of these pathogens and diseases that are spreading, at certain periods of time, need to be um, surveyed, right? Need to be monitored, right? And what generally happens, right? We get sick, right? We go to the doctor. By the way, if you especially in Japan, that you have health insurance, right? Anytime you feel sick, any symptoms, go to the doctor, tell them what you're feeling, let them know that you're having this particular symptom, right? Um, they give you some medicine, they give you evaluated, and it helps report and helps doctors and health officials, you know, um, get an early detection, right? So in general, what happens? You go to the doctor, a doctor essentially reports the case to the government, to the health officials, and then the cases, if there's a trend, they start to get investigated, right? So there is some limitations this way if you want to get some early detection, right? Not all patients that get infected would go to the doctor. Some people just stay at home thinking that they'll get better and everything's all right. And while that does happen, especially, it is important for emerging diseases because you need to, um, help tally and get us, jot down the data, right? But unfortunately, it does happen that not all patients that are infected with the disease will seek healthcare, right? Or those that who do, not all will receive a diagnosis. Some people just, fortunately, some doctors say, okay, you're just having a normal cold, and dismiss you almost immediately. But, it depends, if we're in a time like COVID where there's an emerging disease, to be um, more critical on your analysis, right? And not just that, is there an evaluation method to begin off, right? It took a while to have these COVID tests come out, um, in large amounts for to be available for doctors in general, right? So that also delayed, early detection, right? So yeah, infections could be underreported, right? And this could be a problem, right? In certain populations or certain diseases, especially in developing countries, right? So in general, the reported data usually is lower than the actual number of cases, right? We did see some instances here in Japan and in other places around the world, right? So, um, yeah, from the health side, from the individual's side, there's some limitations there, right? And some people, again, like I mentioned before, don't even get symptoms or get symptoms relatively late, right? So ultimately, there's a limit to the ability that public health officials could respond to epidemics, right? Or pandemics even, right? To respond quickly just because of this limitation, right? So, very interesting. And this deals a lot with data science, right? And informatics, and bioinformatics more specifically, is that, scientists are all the time, trying to explore different ways to monitor disease, right? And the spread of disease. So, um, scientists work with computational biologists, with statisticians, right? And investigate different ways to monitor, right? And one of these is basically using the internet and social media and Google search, right? This was a very novel way um, to look at information, right? And analyze the frequency of different diseases and how people were searching online in regards to these particular diseases, right? Information coming in from, so basically data coming in from Facebook and Twitter and Google search were being collected, analyzed, so scientists could develop a trend, right? Could structure a trend in a pattern in the data, and seeing, you know, people are searching more these things at this particular time, where an infection is occurring, right? In particular locations. So this gave a sense that scientists could follow, right, where the disease was spreading, right? So much, it was so efficient, it was so well used that Google developed a program that can track frequently now, as a general search engine, keywords, influenza, sicknesses, illnesses, right? And so forth and so forth, right? So um it, it was quite impressive. It's still quite impressive, right? And the advantage of this is basically, these digital disease surveillance is happening in real time, and numbers are being plugged in real time data, and graphs are all the time changing and updated and so forth, right? But there are some limitations on that also that I'm going to talk about. But if you take a look here, right, this is, patterns of influenza infection, and Google search activity related to flu-like illnesses in Australia and in the US, right? If you take a look here over, you know, um, over a period of months, right, from January to July, you would get number of confirmed cases, right, laboratory tested of influenza, right, A or B, right. So you would have cases, right, where you would have small little spikes, right, in this the line in orange are the influenza cases, right, and you would see that as people were getting a little bit sick and there was more cases going around in a particular area, right? The number of search in Google would greatly spike, right? So there would be a trend, hey, in this particular area, in Australia, for example, you're getting this increase in activity in terms of Google search, right? So this could give a sense of where there's a certain seasonal spike and location wise also, right? And this one that you see here, this is in 2009, the H1N1. Maybe some of you heard of this. I don't think um, you experienced it though, right? It was in 2009, beginning of influenza. Definitely your parents must have experienced. This was also a swine flu pandemic that was passing by. Um, and again, people were greatly searching, right? What was going on with these symptoms of this swine flu, right? What was the mortality rate and so forth and so forth, and what are some things that you can do to mitigate the symptoms and so forth, right? So, um, it definitely helped, right? It definitely helped. Again, there are some limitations with algorithms, right? How fast data is being inputted, how it's being processed, and so forth. So, um, yeah, it is a tool to help, right? How well are the algorithms to extract data, right? Create, models and so forth and so forth. And uh, you know, and how can you analyze that data? So the thing is, like, can you have an algorithm that really refines the key search and analyzes those key terms that people are suddenly plugging in, right? So is it good at determining whether or not a tweet or a search is actually about an illness? You know, it does happen that a lot of internet activity about a certain illness doesn't necessarily mean that you're sick, right? Or that there's a lot of disease activity, right? It could be skewed, right, by other events. Let's say a lot of people are following a celebrity that has a particular sickness, right, and so forth and so forth. So that can give like a false positive um, um, data, right, um, for scientists, right? So you have to be careful there. While um, you know these types of data doesn't replace doctors and the tallying and the trends of patients, it does serve as a tool, right, to help surveillance, right? Okay, but it does give an additional tool that can complement going to the doctor and plugging in data and reporting, right, and so forth. So having that said, how do you manage an outbreak? Okay, how do you manage a spread of disease that's occurring at a particular location? You're a doctor, you're a health official, and you want to figure it out. What are the steps, right? So, this is what epidemiologists use to basically, you know, go forward with a outbreak, with an epidemic, and so forth, right? So they take a systematic approach, right? That's generally this trend that you see here, right? And we're going to take a look at. And let me just zoom in here so I can show you guys get a clear picture here. Okay. Yeah, so they follow this little approach or this method, right? Independently of the size of the outbreak, right? Could be at a small village community, right? Town or city or a whole region, a whole the world, right? So essentially, when you start to get a lot of individuals coming into the doctor, they're getting reported, you start to see a frequency, right? When you suspect, sorry, that an outbreak is occurring, right? The first thing to do is to really um, analyze that these reported cases are in fact a particular disease that is being on trend, right? Or is it several diseases that is occurring in tandem, right? So you have to figure out if if this disease is really what is causing the outbreak, right? So, first step is to confirm, right, that the reported cases do in fact meet the definition of an outbreak, and this outbreak is basically defined by the number and the diagnosis of certain cases, right? Um, and you compare that generally with known cases in the past, right? Or if this is something newly, completely novel, right? And you generally compare with what is the trend that happens usually throughout the year, right? Did we get influenza more than usual? We get a certain number of influenza cases, and so forth, and you kind of compare that, right? The standard levels, right? And this is something that was happening in Japan right now, that regarding the flesh-eating disease, that is usually a lot higher, right? It's higher than usual. Sorry. Um, yeah, higher than usual, higher than the normal, right? So after that, you get, these health officials, they basically establish a case, right? You have the type of illness, you have a certain kind of telltale symptoms, right? Where is it occurring? The amount of frequency that is occurring in a particular amount of time, right? And you establish your little case study, right? So, and of course, as more cases are coming in, more people are getting sick, these definitions could alter, right, and get refined, fine-tuned, right? So, um, yeah, you create a case definition, right? So then there's a couple of steps you can do, right, afterwards. Okay, you need to find the people, you need to go out and basically gather information, right? And develop a hypothesis on what is actually happening, how is the infection passing through, right? And it's a lot easier when you have a disease where the mechanism of transmission is already known, right? It's much easier because you can kind of pinpoint what's happening, right? But when the mechanism is not known, right, it's a lot more difficult, right? You need to consider more a broader scope in terms of transmission, in terms of potential um, pathogens and cases, right, that are being reported, the source of the disease, right? And usually what happens first is that you find people that are affected by the outbreak, right? Remember that, again, like I mentioned before, not everyone goes and reports to the doctor. They just feel sick and so forth, right? But investigators, they have to go and track, you know, um, eh, eh, the patients, right? They go and track down infected individuals, and they go um, survey them. What was your behavior? Where were you going? Did you eat? Who did you come in contact with? What animals did you come in contact with? What were you, and so forth and so forth. So that's basically contact tracing, right? Where people who may have infected or been infected by um, um, other individuals are basically tracked down, right? So, yeah, it does depend then, on the type of mechanism of transition. Can you, kind of investigate, become a detective, and see what are the trends, what are the instances of the individuals, where were they, um, um, what was the environment they were in, right? Was it in farmland? Were they in contaminated soil or whatnot, right? Um um were they in contact with particular animals and so forth, right? Or what were they doing, right? So it does vary depending on the disease, right, and the mechanism in which it gets transmitted, right? Let's say, for example, this disease is a sexually transmitted disease, right? Only sexual contacts you would go and investigate, right? That would actually be a lot easier if it's sexually transmitted, right? Um, because it's more contained, if I can say, right? But airborne diseases such as tuberculosis, right? You have to deal with close contact, close proximity, right? And then you have to go and contact these people and so forth, right? So that one's a lot more, airborne diseases are a lot more difficult to contend to, right? So, in some cases, people who have been exposed to the same potential source, even if they didn't have direct contact, are investigated, right? Or remember the fomite situation, right? There's a nice little paragraph about the measles, you know, that happened in from Perth to New Zealand, right? Uh, where there was an infection of at least 20 people that it could be traced back to one man who visited Perth from New Zealand based on the efforts made to contact people with symptoms who might have met him. As part of these case findings, investigators may be able to identify the index case or the case that started the outbreak. So you try to figure out, who's the first one that got infected that came to a particular location, right? There's a Perth measles outbreak, right? And it appears that the visiting New Zealander was a super spreader who was identified as patient 0, right? Came in and contaminated everyone. Anyways, yeah, so it's very interesting. You could break down exactly what's happening, right? You confirm an outbreak, case definition, you basically establish, you find the actual cases of the people, right? And you go and check who else have they been in contact to, who themselves, been in contact with somebody else, and then you try to find that index case, that where you get that patient 0, their first individual patient, right? And see a trend in terms of spreading, location, scenario, right? So you gather information and you basically develop a hypothesis on how this disease gets transmitted. Okay. By knowing that, you can implement control measures, or which we're going to take a look at right now. Okay. All right. So let's take a look. Let's continue on. So again, investigators, they gather information. What is actually happening? What are the symptoms of these individuals? How did they get infected? Right. So it does happen. They go and visit patients, right? Health officials, these biologists, these epidemiologists, um, go in. They do interviews, and explore potential sources of infection. Like I mentioned before, what is your activity? Have you been in contact with some individuals that you probably saw in the train that was coughing, or, at a restaurant or something like that? The meal probably was infected with some protozoan, right? Have you traveled recently to certain areas? So all these are relevant questions to kind of narrow down on, um, on the spread of this disease, right? So by understanding these things, again, you can generate a hypothesis on how the outbreak is spreading of this particular pathogen, right? And then, you try to contain it. It's important that's all the ultimate goal there, right? You generate this idea in which you have found enough evidence, right? Or you're trying to collect enough evidence that can support your hypothesis, right? And again, right, more cases, more interviewing people that are infected, right? You inspect the locations where they actually were, these patients, and interacting with the environment and organisms, right? Even the water, right? All these factors that can come in and be a source of disease, right? And then you analyze that and you create an idea, right? After you basically made a big picture, you have these final steps to create a control, right? You want to put some policies to control the spread, right? And then communicate their findings as much as you can, right? And this what was going on with COVID, right? And we basically got, measures on what to do, from the WHO, quarantining, stay home if you're feeling sick, avoid the spread and so forth, wear a mask, wash your hands, and so forth, right? So in practice, both of these steps may take place while other steps are also being undertaken. So everything, it's not necessarily a one-to-one, one follows another. Different things could be occurring in multiple times, right? As you're collecting more data, you're analyzing the current data and so forth, right? What's important is that you see trends, right? You're analyzing data and you're getting some sense of pattern, right? Because if you can understand how it works and you understand how the pattern is going, you can extrapolate and you can actually predict the spread of disease, right? And here's the idea where especially you're getting, mathematicians, computational biologists, bioinformaticians, data scientists, to use algorithm to create their own formulas, their own mathematical models and algorithms to try to predict a disease. How fast can it spread? You know, what's the mode of transmission, and so forth and so forth, right? So, definitely they're used a lot more for emerging pathogens, right? Emerging diseases, uh, especially COVID, right? That we all experienced, right? If you were to change that, you can even model if you were to change environmental conditions, how would it affect the spread of disease, right? So you create models and predict, right? And again, it's a prediction. So there's a certain probability of error, but if you have enough data and you're very meticulous in how you're processing this data, it could be very, very powerful, right? So you could predict the chance that a disease can invade other countries, right? Maybe they have similar environments, right? So you can communicate these findings to other countries so they won't spread the disease further than what was in your current situation, right? So you can expect the number of cases within a particular time frame, effects of potential public health interventions, and so forth and so forth. So these models, they can project, right? How the disease will progress and simulate the effects of possible interventions, right? Used to inform public health interventions such as mass vaccination programs, right? And that's exactly what happened, right, with COVID. All of that is data that we use to gain knowledge to get information that we could um, um, basically create better outputs, right? And methods to control the spread, right? Of course, that uses modern technology, that computers, you do need very potent computers, supercomputing even, that you can process many, many inputs, right, of data and algorithms and so forth, to help give you a certain result, right? Okay, so um, very, very helpful in terms of correlating epidemiology, with computer science, right? Supercomputing has increased the processing capacity and has enabled models to increase their complexity, right? So mathematical models, you basically can put different variables in, right? Let's say like temperature and a certain area, a mode of infection, in terms of distance, right? And so forth. You can create formulas. And the more variables you add into it, you can, you do need more processing power. So these supercomputers, they're called, right, or K computers, can help, process the algorithms with the numbers, right? And again, you can create new relationships, right? Between epidemic frequency and location, factors such as population size, temperature, humidity, right, persistence of the pathogen, antibiotic resistance. All of these things can come into play when you're trying to model, right? So yeah, you can predict, right, a certain trend with a particular disease, right? The figure you see here is basically a map indicating locations, in this case, bat to human transmission of zoonotic diseases, right? This data can be used to predict possible locations for future, right, emerging diseases, right? So here, number of viruses shared between by bats and humans, number of viruses shared by bats and humans, right? So if you take a look here, you basically have these different viruses here. You have the MERS-CoV, SARS-CoV-1, SARS-CoV-2, COVID in Wuhan, right? And so forth, where you have these circulating viruses that could be shared between bats and humans. And if you notice, right, in this particular area, you have the Zaire, Sudan, and Yambuku, Congo, right, is an area that's heavily containing several viruses, Ebola being a very prevalent one, right? But nevertheless, you can have in different areas different types of diseases that could be zoonotic, right? So where's the more likelihood of having a spread or having an area where you can have an outbreak, right? In these areas where you have 8, 12, 16, right? And that's what data shows, right? You generally have more trending viruses emerging from these locations, right? Okay. So definitely analyzing data, very important, right? Um, uh, am I in the right one? Okay. Right. So you collect data, right? But data is quite useless if you don't know how to process it, right? Very important for mathematicians and biologists to know exactly what they're collecting and how to develop trends and basically turn into meaningful results, right? So you can make predictions, right? When you make mathematical models, you do have to make several assumptions, right? Or you do have to limit your algorithm, right? Um, about the variables, or also be very difficult to create a certain trend, right? In order for a model to have a good predictive ability, right, you need to have you need to be able to balance, right, the amount of prediction you want to have with the number of variables and certain assumptions that variables could behave. An assumption could be, let's say, temperature stays stable, right, throughout January to July, right? Temperature doesn't change, humidity doesn't change. So this is an assumption in your mathematical model in which other variables um, could be altering, and you would get certain amount of cases. But the more the more complex your variables become, there's more chance of inaccuracy. Okay, there's more chance of inaccuracy. So it's a little difficult to play with, right? So again, like I mentioned before, to predict disease and how it spreads, you need collaboration within many academics, right? Not just mathematician and biologists and environmental ecologists, right? Climatologists and so forth, right? So for this information to be of value, it must be accurate enough to give you, real or close to what is happening in reality, to have good outputs, right? To have good results. Okay. So um, there's a trade-off, like I mentioned before, right? Between complexity and accuracy. So you do have to find a balance between these two things, right? And try to assert, right? That's why there's a lot of studies. There was a lot of studies going on with COVID, where there's many studies and many papers being published in journals that were actually showing mathematical models on how um, the trend was in terms of spread, right? So again, how reliable your predictions are depends on how robust the data and how accurate the data is. Did you make good surveys? Did you collect the data accurately? Um did you survey a good age range, or just teens that have the most super immune systems, young adults or so forth, right? Did you gender? So all these things, did you take in consideration, right? Okay. if you didn't get enough data, your data wasn't robust enough, it wasn't you didn't have enough sample size, or you didn't collect enough variables, right? And you can't reproduce what you're predicting, then the reliability isn't that great, right? It's a problem, especially with emerging diseases, because it's emerging, right? It's super novel, so you can't get that much information, right? There's a lack of data. Okay. And then lastly, the last aspect that I want to talk about in terms of management is education, right? It is important to educate the public on health and safety, right? And public safety. So um, here you have a situation, a disease modeling expert at the University of Western Australia modeled a potential outbreak of COVID-19 and warned the community that community education for a future outbreak should be a priority, right? Should be a priority to help people cope with lockdown and social distancing measures, right? By understanding what has happened before, if something happens again, you can educate people already, on what to expect, right? Especially in terms if you have to undergo lockdown and social distancing, that was quite detrimental psychologically for many people, right? Um, so education, right? Telling people how, explaining to the public, how diseases work, how do they spread, and what are some likely outcomes, right? And measures that you should expect, right? Okay. So this scientist, he basically modeled this idea of community education, right? And the modeling had shown basically how effectively wind back social distancing without causing another outbreak, right? So the study indicated that in this example, 14 weeks of social distancing was required to significantly reduce the chance of an outbreak occurring. Okay. I think I repeated this picture here. Sorry about that, guys. Okay. So, in general, education, predictive analysis, right, to mitigate more outbreak, more spread of a certain disease, and even future outbreaks can help serve as a management strategy, right? For any disease. Okay, guys. So with that, we have finished chapter 14. Okay, we're going to do an activity to model the disease, the spread of disease. But other than that, in terms of content, we have finished the WACE program. Okay, we have finished uh, everything essentially you need to do. We're going to do a lot of reviewing when we come back. Okay. You will also have your last task, which is basically an extended response on management control strategies. But other than that, guys, we have finished Unit 4 in terms of content. So congratulations on that, guys, and let's study hard for the unit exam and ultimately the ATAR, guys. Okay.